How can we better integrate vulnerable populations into our data lifecycle? It's a question we should all consider, perhaps now more than ever, as the volume of data that we all continue to look at continues to grow and grow. I'm Daniel Burwood. I'm Evidence and Impact Manager at Integrity Action, which is a UK-based NGO with programs currently in Africa and Asia. And I'm going to talk about how we use our mobile app, DevelopmentCheck, in our work to support local vulnerable citizens to monitor the delivery of the vital projects and services they receive or are entitled to receive. We aim to provide these citizens with practical ways of tackling the problems they find and achieving solutions by interacting with the institutions that exist to serve them.
So how do we at Integrity Action integrate vulnerable people into our data lifecycle? First, it's good to be clear what data lifecycle we're talking about. We're not talking here about traditional monitoring, evaluation and learning, or MEL. So in MEL, you may think of data flowing between the donor, between the INGO, such as ourselves, our partners, the citizens that we're working with. You do monitoring, evaluation, learning at all those levels. That's very important. We do that. It's not what I'm talking about here. Here we're looking at a different set of actors, local duty bearers and decision makers. That may be the national government, Ministry of Health, for example. Also frontline contractors, public servants who are providing a service to the citizens. For those who can see this diagram, it's laid out quite old-fashioned really, hierarchical nature with donors at the top. People may not like that, but actually it's quite important here, I think, to reflect the power relationships that are going on, and actually that many citizens, if not all citizens, are vulnerable to the whims, to the decisions that are made above them by their governments, for example. That many citizens are at risk of not receiving services and projects that they rely on, that they've been promised, that they have a right to. And that's especially true, as we know, for certain demographics. So women in many contexts, people with disabilities in many contexts. I'm using the word citizen as well as shorthand, but I am including in that refugees, migrants, stateless people, others who may not have the legal title citizen, but I'm including them and just using it as shorthand. And again, in this diagram, for those who can see, Integrity Action is positioned above the citizens. In this case, that does reflect as well that we do acknowledge that we have an unequal power relationship with the vulnerable communities that we work with. But the data cycle that we're looking at then is about how we can integrate the voices of the local citizens, and particularly the vulnerable citizens, into where decisions about public spending are made. So one way we do this, as mentioned, is our DevelopmentCheck app. This is being used currently by about 450 adults in the countries where we work. Nearly half of those are young women aged 18 to 34, and each is assigned a project or projects that they've chosen in their community to monitor, and the app guides them through a set of questions. I've included a screenshot here in English, but they will use it in their local language, and we have translated it into all the languages where we work. The data that they submit then goes live to our website. Again, for those who can see, the URL is there, integrityaction.org. If you go to DevCheck, you'll find this project, for example, which is construction and drilling of a borehole in Ukunda Ward in Kwale County in Kenya. It gives you information on who is funding the borehole. So here it's the county government of Kwale, for example, and there's a photo. If you scroll down, you'll see more information. You'll see that 21 local people in the community have been surveyed here by the user of the app, and that 66% of them were satisfied with the borehole. If you keep going down, you'll find more information. You'll find that 14 problems have been reported, and 6 of them have been fixed so far. It's the monitor or the user of the DevCheck app that defines really whether a problem has been fixed or not, so they have to be happy that it is resolved. And if you keep going down, you'll see actually the names of the monitors in this case, and as well as the name of our partner, KCNON in this case, who is supporting the monitoring of this particular example. So what are the implications of including local, particularly vulnerable communities in this kind of data lifecycle? Well, one thing you can say is that monitors are not MEL professionals. They may not have, the hard social research skills that we may expect. They may not interpret our questions correctly, or as we would understand them to be interpreted in all cases. As you may expect, when we use more free text open-ended questions, we don't get such a high uptake and we don't get very long answers to them. Another risk is that citizens may struggle to access the information that they need to know in order to monitor the project, due to bearers may be less inclined to share that information with them, particularly more marginalised community members. And of course, very importantly, encouraging vulnerable people to engage in these kind of political conversations and discussions could put themselves at personal risk. That's a big risk. It's something I'll come back to. But there are benefits to doing it as well, which is why we do it. One is that data is available in real time, or certainly more quickly than other methods. That's not just a reflection of the technological aspect of this. Even without the technology, if a community is providing you with information and with data, that's always going to be quicker than if you have to send an external research team to every community that you want data from every time you want data, for example. The data also represents the wider community and represents the voices of the citizens rather than reflecting our own assumptions and inbuilt unconscious biases, for example. That improves the quality of the data. It means that any decisions made from it are based on people's lived realities and are more likely to benefit the people that they're intended to benefit. It can also mean that governments, local governments, service providers may be more inclined to listen because they're listening to their own communities. They might rightly be sceptical of listening to outsiders coming and telling them what to do, but it's harder for them perhaps to ignore their own communities. There's also a benefit to the monitors who use the app. They gain skills and knowledge that they can take beyond the program. For example, they may learn about their local freedom of information laws. They may get experience in using those and accessing information. They may be will be speaking to their local authorities, and that's something they can carry on doing after integrity actions programs are completed. There's also benefits for the monitors that we've seen in terms of their feelings of social acceptance, their confidence, their self-confidence, how they see the community accepting them. We measure this through knowledge, attitude and practice surveys, for example, and we see marked change in feelings of empowerment and so on, and that's true across demographics. So what are the practical considerations that need to be thought about in order to mitigate those risks and obtain the benefits that we know are there? Well, first, accessibility. I've mentioned already that the app is used in many local languages. It's also compatible with standard text-to-speech software for monitors with visual impairments. And importantly, monitors always monitor in pairs, never alone, and this again makes it more accessible for monitors with particular disabilities, for example, or with lower levels of literacy who may not otherwise be able to use the app. We also don't rely on anyone having a smartphone. Most of our monitors don't, and we provide them and train them. So it's not just, it's not only open to people who already have smartphones. And in some projects, we don't use the app at all, really, because they just can't. It's not appropriate to the context, and so we do have alternatives such as, for example, just using posters with traffic light systems on that communicate information to the community. Issues of data quality we look at by using closed questions developed through an open process. What I mean by this is that our question sets tend to have multiple choice questions in them, and they're linked automatically to a predefined set of problem categories, so that monitors don't need to worry about assigning a problem to the correct category, for example. But we develop that list of questions and those links in conversation with the monitors and with the partners in each case to ensure that they are asking the questions that they want to be asking and are relevant for them and are appropriate for them. Those questions include a blend of objective and subjective questions. These have different sections on the app. So earlier in the diagram where it showed the 66% community satisfaction, those community surveys is the subjective side of it. 21 community members in that case had been surveyed, but the problems, the 14 problems, are reported through the other section of the app, which is used only by the monitor, and only the monitor answers those more objective questions. We also have to recognise that this app is only part of the cycle, and the cycle includes open dialogue and anonymous data. Again, earlier you noticed the names of the monitors were on the site, and that's because this is not a mystery shopper approach where members of the community are leaving anonymous reviews. This is part of constructive interaction between duty bearers and citizens, so they also engage in face-to-face joint working groups, for example, and other mechanisms. But at the same time, of course, some data does have to be anonymous and doesn't get uploaded to the website. So information on monitor disabilities, for example, details of the community members who've been surveyed, also the photos that are uploaded, there is a check on those so that no inappropriate or identifiable photos of individuals are uploaded, for example. Then the app is adapted to how it's actually being used. Because the app is about citizens raising their own voice, we don't want to shoehorn them into our own understanding of data quality or MEL. So, for example, those surveys, we don't put a strict sampling methodology on who should be surveyed and at what intervals, for example, but we're including a question on whether the respondent has been surveyed before and how often, so that if the monitor chooses to revisit the same individual over and over again, they can, but we can be aware of that in the data and not double count. Then there's the question of monitor safety and safeguarding, which is of course a big one. We don't want to put anyone at risk. We don't want anyone putting themselves at risk to do monitoring on our behalf. As mentioned, nobody monitors alone. I've been focusing on our adult monitors who monitor in pairs. We also work with a large number of secondary school students, about 6,000 at the moment. They work in clubs of 15, integrity clubs we call them, and that's where they learn about social accountability issues and integrity, as well as carrying out monitoring. Of course, we don't want individual school children going around their communities looking into issues of corruption and so on. It's just not safe. There is also functionality built into the app that if any monitor feels unsafe for any reason, they can report that either to the local partner or to us as Integrity Action. Finally, it is 2020, COVID-19 is out there, we have to acknowledge it. At Integrity Action, we've all been comfortably working from home since early March. It would be incredibly unethical of us to be forcing others, particularly vulnerable communities, to be travelling around, going to health clinics, speaking to members of their community, interacting with people from outside their household in the name of monitoring. So we haven't been asking them to do that. If you want to look at exactly how we have addressed this, we have a blog on our website from August, which goes into more detail. Finally, training. Very important in any program, as we know. Of course, it has to be tailored to the audience. In our case, we've realised that we have to train people even on how to take a smartphone out of a box, how to charge it, how to turn it on, because it's something that hasn't been encountered before. Accessibility is also, of course, important for any training, and so we have to consider, for example, whether the training venue is accessible for people with disabilities and whether the training format is accessible, and so on. So in conclusion, how do we integrate vulnerable populations into our data cycle? We put them in charge of the data, especially collection. We build the cycle around them, so they're integrated, and rather than risking exploiting them by forcing them into our own existing MEL cycle and donor needs, for example. And we acknowledge that there are risks of involving them, but we believe the risks of not involving them and leaving them out are much worse. For example, building data flows that just feed our own assumptions and biases. I was recently looking at some data from one of our programs, looking at the composition of the joint working groups that I mentioned, where monitors interact with duty bearers, and the groups with higher disability representation finding problems and reporting problems at a rate about 50% higher than the other groups, which I don't think is a coincidence. I think is far more likely to reflect the fact that the groups with lower disability representation just simply weren't aware of the challenges being faced by their peers, and that's a gap in the data. So there's still a long way to go, but if you want to find out more, or you want to continue to follow us as we continue to learn, then go to integrityaction.org.